Hello, doctors. This is MedCognito once again, and I want us to review a very, very important MCCQE1 objective, okay? I want to throw some light on a very important MCCQE1 objective. And today I want us to review objective 1074. Objective 1074, and it is broadly categorized as fever in the immune-compromised host or recurrent fever. Fever in the immune-compromised host. But the focus will be that we'll be looking at, opportunistic infections in HIV patients. But before we do that, as usual, I need your full attention. You know that the videos are usually short, so I need your full attention. Put off YouTube, put your phone on airplane mode for the next, 3 to 5 minutes as we do this quick review of this very important subject. So, and that topic, fever in the immune-compromised host or recurrent fever, we have the enabling objective 3A. That talks about construct an effective initial management plan, which includes outlining strategies for the prevention of infection, especially in the immunocompromised host. And today we're going to use HIV as the case study. So, if you are looking at prophylaxis and treatment of, fever and opportunistic infections in HIV patients, I want you to remember the rule of 50s, the rule of 50s, okay? So we have 250, 200, 150. You may be saying, hey, MedCognito, what does this mean? What does this mean? Or what do you want me to use? In your exam, you must always have cues which will guide you to know what to do, okay? So, for example, I talked about the rule of 50s. When somebody's CD4 count is less than 250, the exam is expecting you to know. The exam is expecting you to know that in 250, opportunistic infections like histoplasmosis and coccidioidomycosis are common. And usually you treat them with fluconazole. So 250, histoplasmosis, coccidioidomycosis, fluconazole. Next rule of 50, if it is less than 200, CD4 count, less than 200, think about pneumocystic girovechi. Pneumocystic girovechi. And the prophylaxis for that is TMP SMX, or some will say trimethoprim sulfamethoxazole. Trimethoprim sulfamethoxazole, right? Now, let's go to the next 50. That is, if CD4 count goes below 100, the opportunistic infection there, which can easily rear its head and which you should keep in your mind for your exam preparation, is toxoplasmosis. Toxoplasmosis. And that is, a microscopic view of that. And the treatment for that as well is trimethoprim sulfamethoxazole. Trimethoprim sulfamethoxazole. And the next opportunistic infection, if CD4 count is less than 100, is Mycobacterium tuberculosis. Mycobacterium tuberculosis. And if you want to give, so if you have an HIV patient whose CD4 count is less than 100 and you want to give prophylaxis, you give isoniazid and pyridoxine. Isoniazid and pyridoxine. Isoniazid is the main TB medication you want to use as the prophylaxis, okay? And if the CD4 count goes below 50, these patients are predisposed to Mycobacterium avium complex. Mycobacterium avium complex. And the medication we give is azithromycin. Azithromycin, okay? And another opportunistic infection, which is common if CD4 count goes below 50, is cytomegalovirus. Cytomegalovirus. And the medication we give is ganciclovir. 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 All right? So, good luck on your exam. Keep a positive mind, positive vibes, positive life, and let's keep cracking this exam down. Let's keep memorizing stuff. Let's keep making this exam preparation simpler. All the best in your exam preparation.